Did a scientific study conclude that vitamin D supplements are more effective than flu vaccines in preventing influenza? No, that's not true. Stories making the claim cite reviews and studies that concluded there are significant benefits from maintaining a good level of vitamin D in your system for the prevention of upper respiratory tract infections, such as colds, but only one of the cited vitamin D studies focused on influenza prevention or even reference the flu. The story originated from an article written by Dr. Joseph Mercola, who sells vitamin D supplements, published on September 24, 2019, titled Study, Vitamin D is more effective than flu vaccine, which opened, quote, "Conventional health authorities claim getting a flu shot each year is the best way to ward off influenza. But where's the actual science backing up that claim? If you've repeatedly fallen for this annual propaganda campaign, you may be surprised to find the medical literature suggests vitamin D may actually be a far more effective strategy, and the evidence for this goes back at least a decade." End quote. Users on social media only saw this title, description and thumbnail. Quote, "Study, vitamin D is more effective than flu vaccine. Conventional health authorities claim getting a flu shot each year is the best way to ward off influenza. But where's the actual science backing up that claim? If you've repeatedly fallen for this." End quote. The article then quoted a doctor who wrote about his observations as a psychiatrist in a hospital for the criminally insane. Dr. Cannell did based his conclusions about the benefits of vitamin D on research, but only on what happened during a flu outbreak in the hospital. Quote, "Dr. John Cannell, founder of the Vitamin D Council, was one of the first to introduce the idea that vitamin D deficiency may actually be an underlying cause of influenza. His hypothesis, 1, was initially published in the journal Epidemiology and Infection in 2006. 2, it was subsequently followed up with another study published in the Virology Journal in 2008. 3. End quote. The first citation is from Dr. Cannell's article titled Review Article, Epidemic Influenza and Vitamin D, which concluded, quote, "Conclusion there is much evidence to suggest that vitamin D may be Hope Simpson's seasonal stimulus. Nevertheless, it is premature to recommend vitamin D for either the prevention or treatment of viral respiratory infections. It is not, however, too early to recommend that healthcare providers aggressively diagnose and adequately treat vitamin D deficiency." End quote. The second citation is from a paper, not a study, by Dr. Cannell titled On the Epidemiology of Influenza that explains his hypothesis that vitamin D could help prevent influenza. Again, this is not a study as claimed in the article. The article then references a 2009 study, yes, an actual published study titled Association between serum 25-hydroxyvitamin D level and upper respiratory tract infection in the Third National Health and Nutrition Examination Survey. Quote, "The following year, the largest nationally representative study of its kind to date discovered that people with the lowest vitamin D levels indeed reported having significantly more colds or cases of the flu. In conclusion, lead author Dr. Adik Ginde stated, the findings of our study support an important role for vitamin D in prevention of common respiratory infections, such as colds and the flu. Individuals with common lung diseases, such as asthma or emphysema, may be particularly susceptible to respiratory infections from vitamin D deficiency." End quote. But that quote is not in the study. The researchers focused on the common cold, not influenza, and vitamin D. The quote Dr. Ginde is from a news release issued by a hospital. Quote, "Upper respiratory tract infection (URTI), or the common cold, is the most widespread infectious disease and the most common reason for U.S. emergency department visits and unscheduled outpatient visits. 1 More than 200 viruses contribute to the clinical syndrome of cough, nasal congestion, nasal discharge, sore throat, and sneezing. 2. 3 Most adults in the United States experience 2 to 4 URTIs per year, and most children experience 6 to 10 per year, which carries enormous population morbidity due to the high incidence of disease and disruption caused by symptoms. 4, 5. End quote. There are major distinctions between the common cold and the flu, according to Healthline.com's definition of acute upper respiratory infection. Quote, "What is acute upper respiratory infection? Anyone who has ever had a cold knows about acute respiratory infections (URIs). An acute URI is a contagious infection of your upper respiratory tract. Your upper respiratory tract includes the nose, throat, pharynx, larynx, and bronchi.